Hey San Diego, this is Dr. Jason Shumard with Integrative Wellness Center of San Diego. And today we're going to be discussing a very important topic, probably one of the most common questions that I get from patients in our office that are dealing with type 2 diabetes. And that question is, why does my blood sugar continue to rise even when I'm taking medication? I can't tell you how often I get this question so many times in the office. And it's interesting because the many people believe that the reason why their blood sugars are going up, even with medication, is that their body is becoming immune, or it's getting, the medication is not really working anymore, in a sense that their body is not able to accept it anymore. And that's really not the case. What's really the case, what's happening to the surface, is that it's not that the medication is not working or doing its job. It's that your body, or the problem, if you will, is worsening. See, it's very commonly thought with diabetes that your blood sugar being elevated is the cause of your diabetes. And that's not the case. Your blood sugar is actually a symptom of the diabetes, meaning as the symptoms increase, maybe you're thinking, well, I need to take more medication, or I need to decrease my diet, or change my diet, or cut down on food. And that's typically the traditional thought process with diabetes. Well, I'm here to tell you that is absolutely incorrect, unless your goal is to reduce blood sugars. If your goal is only to reduce blood sugars, and that's the only purpose you want to work on, then yes, changing your diet, exercising, losing weight, taking your medication will help you lower your blood sugars. But what it will not do is help you reverse your diabetes. That will not happen. So if your goal is to reverse diabetes, there has to be additional steps that are involved. And what's happening in this situation, when you start taking a medication, let's say that it's glipizide, for example. Now, the job of glipizide is to tell your pancreas to produce excessive amounts of insulin. Now, the problem with that is that you, as a diabetic, you have what's referred to as insulin resistance, right? Insulin resistance means that your cells are no longer able to accept the insulin. And as enough of the cells in the body get to that state, you're then going to have a much more difficult time to use the insulin to then allow the sugar to get into the cells so the body can use it as energy and do the job that it's supposed to be doing. Regulating blood sugar is one of the most basic fundamental functions of the human body. So if you're no longer able to regulate blood sugars anymore, something must be broken. Something went haywire inside your system. And when that doesn't work, if your sugars have nowhere else to go, then they're going to go back into the bloodstream. And what's that going to cause? Elevated blood sugar. So of course you can eat better, you can cut calories, you can exercise to burn some of that sugar off, you can lose some weight to help as well, but it's never going to fix the underlying mechanism, which is the insulin resistance. So if you really want to reverse your diabetes, you have to understand, why do you have insulin resistance, and what's really going on under the surface. And that's what we do in our office, is we help patients understand what is causing their diabetes, what is causing the insulin resistance, and not just focusing on the sugars. So getting back to the statement is, why does your blood sugar continue to rise even though you're taking medication? And it's not that, again, not because your body is no longer accepting the medication or utilizing the medication. It's still doing its job. It's still telling your pancreas to produce excessive sugar in regards to glipizide, as an example. The problem comes into play is that the more insulin that gets into your body, what's called hyperinsulinemia, the more insulin that's inside your body or in your bloodstream, the more insulin resistant you will become. So an example of this would be, imagine if we had a plant, like a small little plant, and we started dumping water on that plant constantly, over and over and over and over again. Eventually, what would happen to the plant? Yeah, it would become very saturated. The plant will start to wilt, maybe eventually start to die. Well, the same thing happens to the cells of your body. Once you start having excessive amounts of insulin being dumped into your system and essentially just coating and saturating those cells, over time, those cells become desensitized to insulin, and they no longer can accept insulin, which means your sugar can't be used as ATP or energy production. Now, when more of those cells happen over and over, you become more insulin resistant. So think about this. If the job of that medication, glipizide, for example, is to tell your pancreas and literally squeeze out more insulin, what sense does it make as a treatment option to give someone more insulin when they're insulin dependent or insulin resistant? Of course, it makes no sense whatsoever, but this is the common treatment because it's a seek and destroy mission, trying to find any cell that they can find to help you lower that sugar. Hence the reason why you get worse with time, especially when you're taking medications like that. Over time, what happens, you become more insulin resistant. And when you become more insulin resistant, you now need additional or an increased medication. So maybe you go from 10 milligrams to 20 milligrams to 30 to 40, whatever that might be. And then eventually there's a max point. And then what's the next step, right? What's the next step after taking a medication like that? More insulin, right? Think about this. It's almost like insanity to an extent, because of course it does its job for a little while, but over time it's going to make things worse. The more insulin that you put into your body, from a capsule you take telling your pancreas to produce more insulin, or if you're injecting insulin into your body, the more insulin resistant you become. And you see this over and over and over again. And if you're watching this video right now and you're taking one of those types of medications, or if you're taking insulin, you have probably seen this on yourself. Maybe you were taking a small amount to begin with, and then it started increasing more and more and more. And the other reason behind that is because the focus is to lower blood sugar. Well, the reality is blood sugar is a symptom of the disease, right? Just like if you had a cough, a sneeze, or a headache, there's something causing that, right? Maybe it's an infection or something else going on inside your body that's not right, an allergy, whatever it might be, something is causing that response to occur in your body. Well, diabetes is no different. Something is causing your blood sugars to go high. Something is causing to have insulin resistance. Now, you can make a choice. Your choice can be to focus on trying to reduce sugars, which is essentially trying to reduce the symptom, or you can focus on trying to find the cause of it, fixing the cause so your symptoms subside on their own. It's no different than the analogy if you have an infection in your body and you're only focusing on your sore throat, runny nose, and headache, taking products for that, trying to suppress a symptom and not doing anything with the infection. Over time, that infection is going to get worse, you're going to get worse, and start having other symptoms. Well, diabetes is no different. That's why we can see individuals who have a managed hemoglobin A1C below a 7, and they're still experiencing complications. They still have neuropathy. They still have pain. They still have visual issues or kidney problems or cardiovascular issues or whatever it might be of the other types of complications that the person's experiencing with diabetes. So managing the sugars, lowering sugars may help reduce the risk of advancing these complications or maybe an earlier death, but it doesn't fix the problem. This is why when you're meeting with your healthcare practitioners, they're usually going to talk about how we can manage your disease, how we can help you slow down the progression, and they're not going to discuss with you what to find or how to find the underlying problems, how to find the underlying issues that is causing your insulin resistance. And one of the things that in this situation is why so many diabetics have to continue to take more and more medication. When a diabetic is initially diagnosed, they may take 1 to 3 oral medications to begin with. But as the years go on, they're taking 6, 8, 10, 12 plus medications every single day, and they still don't feel good. So if this is your situation, if you're in this path right now where you're taking more and more meds, your doctor wants to continue giving you more and more meds, you don't feel good, you don't feel like you're on the right path, you've tried different things, it's not helping you, maybe it's time to start looking or meeting with someone who can actually investigate what's truly going on with you right now, what's truly the underlying causes, and give you a specific customized approach. So hopefully this kind of gives you a little more understanding of if you're in that scenario right now where you're taking this medication and you're so frustrated because your blood sugars continue to rise, even though you're doing the right things, and maybe you're not addressing what's really going on under the surface. Hey, if this video was worth it for you today and you felt that it was very educational and you felt like you got some good information out of this, please like this video. It really helps us so we can disseminate this information to as many people as possible. Share it if you felt something is positive, and you should share it to some family members or friends or coworkers or your spouse, or just you want to put on your social media because you want to make sure people who need this information are getting this. It is so important, especially with what's going on right now. There are so many people vulnerable. Diabetics are the most vulnerable to these types of viruses and other types of potential future pandemics that may come down the road. Anything that you can do right now to help you reverse your diabetes, to take control of your health, that needs to be done immediately. So again, I hope you enjoyed this video. If you did, please like it. Comments, if you have any comments of, hey, I love the video, or can you talk about this? I'm having this specific problem, my spouse is. If there's some kind of topic you want me to discuss, I'm more than happy to put a video together for you. And also, please, I'm just asking, share this information. It's really important that people understand what's really going on. And if there's anything that I can do to help you, please reach out. I'll put our information in the comments below of our office with our phone number. You can contact one of our staff. They'll get you scheduled for a one-on-one consultation. We can either do that virtually, if that's what you feel more comfortable with, or you can actually come into the office and we can meet one-on-one. And so I can evaluate your case to see if the type of protocols, if the model that we do here in our office may be appropriate for you to help you reverse your diabetes, like we've done with so many other patients over the years and working with them. Have a great rest of your day, you guys. We'll see you on your next video. Take care. Bye-bye.